Good morning, and thank you very much for joining us this morning. As president of the Canadian Association for the Study of Liver, otherwise known as CASL, it's an honor and a privilege to be here in Canada's Parliament to make liver health a priority for Canadians. CASL represents Canada's Liver Experts, a non-profit dedicated to eliminating liver disease through research, education, and advocacy. Our members across Canada include hepatologists, gastroenterologists, pediatricians, surgeons, radiologists, researchers, nurses, trainees, community advocates, as well as patients and family partners. I think it's especially poignant to be here today because tomorrow, April 19th, is World Liver Day. So the reason we're here is because Canada isn't doing enough to address liver disease. We are concerned that Canadians don't know the signs of liver disease and are frequently not receiving testing and treatment due to misconceptions and/or stigma surrounding their health, their liver health. The liver's importance as an organ cannot be overstated. It's involved in everything we consume, breathe, or otherwise use on our bodies. It drives all of our critical systems, digests fats and proteins, filters drugs and alcohol, and regulates body fluids. We at CASL are dedicated to changing the status quo and promoting awareness not only of the signs of liver disease, but also the behaviors associated with it to prevent the prevalence of liver disease and liver-associated cancers. I will now introduce Dr. Carla Coff, our President-elect, to provide further comments. Thank you.
Thank you, Dr. Swain, for the introduction. Liver health is a critical topic that many Canadians don't know about. This needs to change. As of this minute, approximately 1 in 4 Canadians are affected and living with liver disease. With the healthcare system still recovering from the COVID-19 pandemic, it's never been more important to know the signs and symptoms prior to experiencing a medical emergency due to liver failure. One of the most pressing diseases we need to begin talking about is non-alcoholic fatty liver disease. There's a stigma, also demonstrated by the reaction to the recent alcohol consumption guidelines, that liver disease is only caused by alcohol and medication consumption alone. While these are significant contributions to overall liver health, non-alcoholic fatty liver disease, or NAFLD, is capable of developing in approximately 30% of Canadians who are overweight, and most of them don't know about it. If left untested and unknown, it can lead to liver cirrhosis or even liver cancer. If Canadians aren't properly aware of their at-risk status and don't realize the symptoms and seek testing, their only option may be to receive a liver transplant. This is an unseen public health crisis. I'd also like to talk about viral hepatitis. Hepatitis B and hepatitis C, also known as HBV or HCV, are an inflammation of the liver that spreads incredibly quickly and is a global cause of liver cancer. We have the ability to eradicate viral hepatitis B or C in our lifetime if we commit to action now. Canada has already signed onto the World Health Organization's global viral hepatitis strategy aimed to eradicate these infections by 2030, but we're falling behind. We need to immediately improve awareness of the disease and its causes, but also harmonize Canada's health jurisdictions to create a proper national action plan. Removing a significant contributor to potential cancer in Canada is within our reach. It must be our priority. We can and must do more on liver health. It is now my great pleasure to introduce Heather Watson, the chair of CASL, or the Canadian Association for the Study of the Liver Disease Community Advisory Board, to conclude this press conference.
Thank you, Dr. Coffin. The Community Advisory Board is comprised of community advocates with experience in liver disease. Personally, I was diagnosed with NASH in 2016 and had no awareness of the disease or NAFLD prior to that. and received a full liver transplant in 2018. I'm here with the Canadian Association for the Study of Liver, Canada's liver experts, to share why liver health is so important. Thanks to the tireless advocacy efforts of health industry alliances over past decades, we've made incredible strides in promoting awareness of heart, skin, and mental health alongside others. But the liver is often forgotten, despite being one of the most important organs in our bodies. I'd like to restate the importance of what Dr. Coffin highlighted earlier. We can eradicate a leading global cause of cancer within our lifetime. It's not often that we get this opportunity, and the more we put into place early on, the better our chances of success. Liver health is a potentially unseen public health crisis that so many Canadians don't yet realize, myself included. We're here to change this now, and we encourage awareness, testing, and treatment that's readily available to improve lives immediately. Let's keep ourselves and our families informed and safe, and let's finally talk about liver health. Thank you. Are there any questions?
Just a reminder for the people joining us on Zoom, if you have a question, please use the raise hand function. Pour les gens qui nous joindront sur Zoom, si vous avez une question, s'il vous plaît, utilisez la fonction main levée. We have no questions online. Merci beaucoup. Thank you very much.
Thank you. Merci.